Babies born at least 3 weeks before their due date are preterm or premature. Early births are the single biggest cause of newborn deaths and the leading cause of cerebral palsy. The annual March of Dimes National Report Card released today finds San Diego has one of the lowest rates of premature births in the 100 largest cities in the U.S. Joining me with a look at the report and what's being done to decrease preterm births are my guests, Victoria Lombardo with the March of Dimes and Dr. Anup Katheria, Director of Sharp Mary Birch Neonatal Research Institute. And Vicki, San Diego's rate of premature birth, from your report I found, is 8.3% of all live births. That puts us in the top 10 best cities for having the least amount of preterm births. But the city's still got a B. How come we got a B instead of an A?
Because the goal for the March of Dimes is to reach an 8.1 level. And you're more than one standard deviation from that 8.1. So you, like California, have a B.
And Chula Vista actually was separated out, and they had a 9.1 rate, which was also a B. So what's the situation in Chula Vista?
Chula Vista has probably, my guess would be that they have an access to care issue, and the moms just don't know what to do. The March of Dimes is doing a lot of education with clinics and doctors to help them teach moms what to do to be healthy.
According to your findings, what are the racial and age disparities when it comes to early births?
Across the country, the biggest risk is in our African American moms. They have the highest rate, followed closely by our Native American moms. In the state of California, though, it's our Asian moms that have the lowest preterm birth rate.
So the lowest preterm in the Asian population, higher in Native American and African Americans. Yes. Doctor, do we know some of the reasons why these disparities are? Is it genetic? Do we know what's causing the differences?
The truth is we don't have a clear answer. I think it's going to be multiple causes. You highlighted genetics, and I think the other one is access to care. I think many of these families don't get care early enough to be able to treat their pregnancies and allow their babies to go to full term.
And Dr. Katheria, what are the survival rates and the biggest medical concerns for babies that are born too early?
Well, the survival rates get worse the more premature the baby is. So currently we have the technology to take care of babies born up to 4 months early. And those survival rates are poor. They're less than 50%. And not only do when they survive, the risk of cerebral palsy and other neural problems are much higher. But the closer you get to term, the less long-term problems, and the survival rates are much higher. Overall, the survival rates for most premature babies are in the 80s to 90%.
I also understand that you've been doing some innovative treatments for premature babies. One of them involves keeping the babies connected to their mothers at birth. Tell me about that.
Yeah, well, while it's innovative, it's really quite simple. When a baby's born, rather than rushing to do something, you're really doing nothing. You're letting that baby stay connected to the mother and then providing assistance for breathing and etc. technologies. I think the biggest thing that we've sort of moved away from is the whole idea of rushing to provide assistance for babies, whisking the babies off to other rooms where the parents have no idea what's going on with their child, fearing the worst.
So I just want to say, though, to be clear, when you say connected, you're saying you're leaving the umbilical cord attached to the mother's placenta.
Yes, so what we're doing is after the baby's born, we're leaving the baby then connected to the mother with the placenta still inside the mother, and we have a little bed that comes up next to the mother that allows the baby to receive breathing assistance while at the same time getting this extra blood. And one of the things I always like to highlight is that preterm babies are very different than full-term babies. If you're born before 30 weeks, you leave 50% of the blood behind if you cut the cord right away. And that's blood that's not just blood, but it has stem cells, immune-fighting cells, a lot of cells that help these babies protect their brain, help blood go to their organs, and sort of promote long-term development in these babies.
And Vicki, what are some of the reasons we've been talking about the premature babies, but our rate has been dropping here in San Diego? What are some of the reasons behind that?
Some of the reasons are just the education of the physicians and nurses about not being too anxious to electively deliver babies before 39 weeks gestation. Papers and studies have come out showing the significant brain development that happens, as well as the risk for complications if we get just too impatient and we deliver too soon. So just waiting makes a big difference.
I see Dr. Katheria nodding his head. So I guess my last question to you that we have to end on is, what is the best way? Is there one singular way to decrease premature births here?
No. We don't have a single best way. I think it's going to be comprehensive care and looking at some of the new things that the March of Dimes is doing to help promote pregnancy longer and look at maternal factors.
All right. Well, you can read the entire March of Dimes report on our website, kpbs.org. Dr. Anup Katheria and Vicki Lombardo, thank you so much.
Thank you.